is American Heart Month, and Houston is kind of the epicenter of all things medical, especially when it comes to cardiovascular care. And I'm very excited to be here today with one of the specialists in the field, Dr. Pranav Loyalka. He is here to give us some advice about HCA Houston Healthcare and how we can actually be educated and know the facts when it comes to heart care. Pleasure to be with you today.
Thank you.
So let's just start by saying HCA Houston Healthcare is the leading provider of healthcare in the Houston area, and there's physicians and nurses and allied health professionals. They treat almost 1 million patients a year.
It's a lot of people, and that's through a lot of locations throughout the city. We have 13 locations in addition to our emergency rooms, our emergency urgent care centers, a lot of places.
Well, let's discuss people's journey to getting better health care and the symptoms they need to look for, any type of awareness that we should be starting with. What's the very first part that you suggest? Just the awareness.
I think the awareness is anytime you certainly have chest pain or you have shortness of breath, certainly you should be thinking about the heart, thinking, hey, is this something I need to go to my physician about? And if you think about it, you should do it.
If you experience any pain, never wait. There's never a second guess. Always go in for help.
Correct. But again, I think you also have to be smart about it. There are a lot of people who will think, oh my gosh, this twinges a little bit. Certainly I would say if you have pain, especially if you're moving around and you get pain while you're active, even if you're still and you're short of breath, you get sweating, there are a lot of symptoms that come up. You should seek help.
Is there a specific age that you should be more aware of?
It's interesting. I think 5-10 years ago we would have said, hey, if you're 60, 70 years old, certainly do that. But I see patients now in their 20s and 30s who have coronary artery disease and get in trouble. I would say, hey, if you've got diabetes, if you've got high blood pressure, if you've got high cholesterol, a family history, if you're a smoker, those are red flags for really having coronary disease in addition to your age, and really should seek help at that time. So
if cardiovascular problems run in your family, that's definitely somewhere you should start.
Absolutely.
Now, you mentioned the symptoms. That's chest pain, the tingling. Is that also a symptom that people should be aware of?
It can be. Realize in men, that's maybe the typical symptom is that you'll get that elephant on your chest, you'll get short of breath, you'll get maybe left arm pain. Women can have a lot of atypical features. So for women, I wouldn't wait for a classic set of symptoms. As I said, if you know that you've got risk factors and you're getting short of breath or you're having any sort of chest discomfort, you should get it checked out.
Now, let's talk about diet, because what you eat, what you consume plays a big role in how your heart reacts to that. What is a good place to kind of start with your diet? What kind of changes should we be making?
It's funny, there are a lot of fad diets out there.
Yes, there are.
And there are a lot of diets that, are fairly extreme. I think there's some principles that should guide you there. One is moderation. Realize that heart disease is really a modern disease. It's a disease of oils. It's a disease of having plenty of food, of less exercise. And so if you're looking at a diet, it should be one that fulfills your caloric needs, so 2,000 calories a day for most people, and is well balanced as far as carbohydrates, proteins, and fats.
You briefly mentioned smokers. Obviously, it's not a good thing to start. It's not a good habit. For people who are already smokers and who are a little bit concerned about their heart health, it's still okay for them to change their habits, correct? If they quit smoking?
Absolutely. So you stop smoking, your risk starts going down. We've seen a lot of patients who maybe have had a heart attack. And, this is more, hey, let me tell you about a case. They stop smoking, the disease stops where it is. As long as they're on good medications for their cholesterol, we control their other risk factors, they eat healthy. And in some cases, if you get the cholesterol low enough, you can see reversal of some disease.
That's wonderful tips right there. So tell us a little bit about the HCA Houston Healthcare services that you guys offer here.
So in HCA Houston Healthcare, we offer the full line of services. We offer, bypass surgery. We offer straightforward, stenting. We're doing a lot of high-risk cases now. Typically, what the medical center has done, we are offering almost all of those services. This year, we will probably start with mechanical hearts,
Wow.
and doing left ventricular assist devices. Hopefully by the end of the year, we'll be doing cardiac transplant. So HCA Houston Healthcare really will be offering everything that has traditionally been offered in Houston.
Plus all of the advances in the technology.
Correct.
That's wonderful. Dr. Loyalka, thank you so much for your time. We really appreciate it, sharing your knowledge with us today. For more information, just log on to hcahoustonhealthcare.com/care.